Last time we talked about 988, and I'll reiterate some of the stuff about 988 at the end. But something that I thought was important to talk about was AI chatbots and mental health. One of the reasons I think this is really important is because we see AI in a lot of places these days. So developers are really pushing AI. AI has been added to Google searches, to our email, to our apps. Many things have an additional kind of AI component, if not being an app like ChatGPT that is all AI, and that's what it's all about, which is what an AI chatbot is, and we'll talk about that more in a second. But AI is in a lot of places, and I just wanted to point out, just because it's ever present doesn't mean that it is safe and safe to utilize for all sorts of things. I just wanted to point out too that there's serious risks that are associated in using AI chatbots like there, and it's something that people do, and it can be really risky. So we'll talk about what some of those risks are. Some of the reasons why people do that is because it can sometimes be hard to access mental health care. That's one of the reasons why I want to just really reiterate about 988 as being somewhere that you can reach out to, that it's an actual person that is trained to talk about mental health issues with you. So just as a starting point, what is an AI chatbot? So you've probably seen these. ChatGPT is one of the biggest ones. Claude is one. Gemini. They're becoming more and more sort of present in the virtual sort of space. And chatbots are online programs that have been designed to simulate human conversation. So they pull a lot of sample conversations, sample ways people talk on the internet. It's a computer program that is programmed to talk to you, but it is not a real person. So when you are talking to an AI chatbot, you are interacting with a computer program, not a real person. So that's an important distinction to make. Their responses can sound like they're coming from a person, but there's not another person on the end of that chat. That is a computer program. When we're looking for mental health support, asking AI chats being maybe more accessible to us than therapy, what's the difference? What are the things that we need to keep in mind with this? And all of this text too comes from the Public Health Collaborative that works on emerging health issues. So this is something that they are encouraging people to talk about. So that's where these are coming from. So an important point, and this is true whether it's AI chatbots or just having a conversation with someone, conversation itself isn't therapy. Therapists are trained to diagnose, reduce harm, create a health plan with you, to work with you on whatever mental health challenges you're having, which is a different thing than just having a conversation, and especially with having a conversation with a chatbot. A chatbot can't diagnose, they can't act with harm reduction intent on a regular basis, and they can't create a health plan with you. So these are all things that there needs to be a person who's trained to do in order to make sure that you're following the mental health plan that you need specifically. And that's why therapists too have credentials, are accredited. That is a very particular kind of training that isn't just about having a conversation. Also, artificial intelligence and these chatbots can be dangerous to people in crisis experiencing serious mental health symptoms. Part of the reason for that is that chatbots are trained to be affirming of you. So they're trained to agree with you on many things or back up the things that you're saying. And sometimes in the case of mental health, you need someone to be intervening and working with you in a way other than affirming things that might be harmful behaviors. If you're thinking about self-harm, if you're thinking about something that could perhaps be dangerous to you, anything like that, if you're having suicidal thoughts, it's not helpful to be affirmed in those thoughts by a chatbot. You need somebody who is trained to talk about mental health issues to have a conversation with you about how not to self-harm, how not to do those things, and what support you have to not do that. That can be one major red flag with using the chatbots for mental health care or guidance. We want to make sure that you stay safe, and that requires a little bit more nimbleness in response than chatbots can provide. A lot more, actually. Also, chatbots are designed to generate a response, not provide treatment. So I said this already, but they're getting information that's scraped from the internet. And the information on the internet, as we know, is not always accurate, is not always true, is not always up to date, all of those things. So you're getting this conglomeration of different things from the internet that hasn't been tested for its truth and its reality and its validity. Some AI models are designed to use emotions to help you in conversation, to affirm you in that way. And this sort of relationship that you establish with an AI chatbot, who is not actually a person, can be harmful to your mental health as opposed to helpful. You can start thinking that this is a person. It can feel like you're having a conversation with a person, but it's important to remember that is not the same thing. This isn't actually a person, no matter how much they are replicating conversation. This is a really important one, I think, is every brain is one of a kind and chatbots are one size fits all. As much as they can learn your brain, your mental health situation, your stressors, all of those things, nobody is experiencing the exact same thing as you. And artificial intelligence is engineered to respond to these certain prompts. So you don't get treated like the specific person that you are. A medical expert will actually ask you the questions that they need to ask you in order to get to the answers that can help them design a treatment plan for you. And then you can talk about options. These are things that chatbots are not able to do with you, and not in the specificity that your particular mind needs. Your experiences are unique, and that's what another human being can acknowledge. Another thing too, just as a practical and privacy issue, is that the information that you share on ChatGPT or some of these other chatbots is not protected by HIPAA often. Your privacy isn't guaranteed. The chatbot very likely is learning from your conversation to then apply that to other conversations. So you're not in a private HIPAA protected medical space when you're having that conversation. Not only is the provider not medically trained, but it's not a provider. You're not receiving clinical advice. You're also not getting the privacy that goes with being in an actual medical setting with a trained professional, which is important when we're talking about mental health. You don't want that information to be shared with no restraint. Also, chatbots are not telehealth professionals. If you are working on getting access to mental health care, if you have problems with mobility, if you would rather do therapy or something like that from the privacy of your home, there are telehealth options available for therapy. And that is something that you can talk to 988 about. You can look at their website to see what's available as far as telehealth goes. So you can have a conversation with a real therapist through telehealth from the comfort and the convenience of your own home. That is far superior to relying on chatbots that are not actually a person who is clinically trained. So if there's an issue of convenience, that's something to definitely look into. A lot of places do virtual therapy sessions now, especially since 2020, since COVID. A lot of places offer that because they got used to doing it during the pandemic. It's easier, I think, to find than it used to be. So again, the bottom line is if you find yourself in a situation where you need immediate mental health support, you don't currently have access to a counselor, and you need to talk to someone, call 988. That's what it's there for. There are trained counselors on the other end of that who know how to deal with mental health crises. That's what they do. And you're much safer and in a much better place than if you're relying on AI chatbots for that. You can also research professional support. We talked about the resources that are available on the 988 website. Then if you have a doctor, if you have a nurse practitioner, if you have anyone who's providing you healthcare, they should be able to offer you a referral to mental health support of whatever kind you need. The rule of thumb is if you need support, reach out to a person. So a person could be someone at SMART, a person could be someone on 988, a person could be your doctor, but make sure it's a person that you're reaching out to and that you're not relying on AI to help you through what is really an important and critical process that AI is not trained to do. If you're having trouble, you can always call 988, text 988. Another point I wanted to make is that last time we talked about how you can chat with 988, like in the browser. I want you to know that chat that you're having, the person will introduce themselves. That is a person on the other end of it. That is not a chatbot. So nothing associated with 988 is going to be an AI program. It has the same format, but that is a real person. They will give you their name. They will give you their credentials if you ask for them. So just know that is a legitimate counselor on the other end of that conversation when you go to the 988 website and start a chat. Same with texting them, same with calling them. You're going to be talking to somebody who is a trained counselor. If you need additional support and you're from a particular community, if you're trans, if you're LGBT and you want care that you know is going to be affirming, if you have specific issues that are related to your identity as a trans person or LGBT person, or if you are experiencing domestic violence, these are specific numbers that you can call for that as well. If you are a part of a community that you want affirming care and you don't see a number that is related to what it is you're looking for, let us know because it probably does exist and we can help you find it. Bottom line, when you need mental health support, talk to a person, not a chatbot. If you leave with anything, that's my guidance for you today.